Hi, good morning. So today I'm going to share with you my personal experience with Femerel. Okay, Femerel is actually a supplement that's being given for perimenopausal and menopausal women. You heard it right, perimenopause and menopause. I am in my 40s now, and unfortunately I'm starting to feel actually the effects of the fluctuations of my hormones. So I'm starting to feel all these changes in my body. Much as I want to, what do you call this, deny the fact that I am aging already. It's something that I cannot stop, okay? Time is not on our side, okay? There are a lot of changes that happen in our body already, and we just need to actually work around it to be able to survive it and to be able to, still live a very productive and happy life despite all the symptoms that we are feeling. So, perimenopause. But before I talk about my personal experience, now let me just quickly define what perimenopause is. So perimenopause is that period in a woman's life wherein you transition from being in the reproductive age into menopause. Okay, this is usually about 5 to 7 years. There are some women who even experience 10 years of perimenopause before the actual onset of menopause. When we say that you're menopause, that's 12 months of continuously not experiencing any menstrual cycle. Okay, so perimenopause is that period wherein a woman starts to feel hot flushes, cold intolerance, easy fatigability, pains, aches and pains all over, mga joint pains, and then you may also have dry skin. So ang manifestation is it's kind of, you just have an itch all over. You also feel vaginal dryness, and you may also have irritability. So, I think yung patience mo medyo mas maigsi na ng konti. And then, what also happens is you may start experiencing irregularity in your cycle. My part, what I've experienced is irregular cycles. Okay, so I have irregular cycles now. Sometimes I would have it every 3 months or 2 months, which is not really normal for me kasi ever since I've had my menses when I was 11 years old, regular and irregular ang menstruation ko. So, irregular cycles. Tapos, night sweats pala, okay, which is related to the hot flushes. But night sweats, technically, you sleep and then you wake up drenched in sweat. Tapos sobra kang init na you wanna take a bath. Kasi just to relieve that, that very hot feeling in your body. So ako ganun ako, and it was giving me a hard time in terms of sleep. Kasi in the middle of the night, I would wake up, and then after I would take a quick shower, it would be hard for me to to actually sleep again for the next 30 minutes to an hour. So it disrupts my sleep. So ergo, in the morning, I'm kind of cranky kasi kulang na nga sa tulog. So there, so it's really more of, so personally for me, it was really more of night sweats, and irregularity in the cycle. And then this was like last year. This year, it was more of irritability and easy fatigability. So, ang dali kong mapagod. And, I mean, I'm such an energetic person. Yun nga yung tawag nga sa akin, parang energizer bunny, parang going and going and going and going. But, the past few months, when it hits like, the day hits like around 4 o'clock, 5 o'clock, para akong nalulubat talaga. So it was kind of bothersome kasi it would really disrupt my routine. So there, so but initially it was kind of, I could tolerate it and I could live with it, but the past month medyo mas madalas na yung easy fatigability. It was becoming very frequent. And so I decided to actually take Femerel, okay? So what I took was Femerel Rejuvenate, which is for perimenopausal women. And it, if you read my article in my page, Pillow Talk with Doc Mitch Dado, about Femerel, it actually addresses all these symptoms that I talked about. And personally, I started taking it last month. Initially, I didn't follow the dose. So don't tell them. Don't tell the people from Femerel that I did not follow the dose. So initially, the first week, I was just taking it once a week. But you know what? After a week, I started feeling better. The easy fatigability was not that pronounced anymore. I wasn't having night sweats anymore. So once a day pa lang yan, and it was really giving me much relief already. But the usual and the recommended dosage is twice a day. So now I'm taking it twice a day and I feel better. I feel less tired. My irritability is well in control, and then I don't have night sweats anymore. And although syempre my cycle is still irregular, wala na yata talaga tayong magagawa doon. But you know, my intake of Femerel made my life much better. And if before, I would just recommend it to my patients because, you know, based on the studies and based on the experiences of other patients, I would actually prescribe it. But now, I'm basing it on my personal experience, and it's very effective. It worked for me. Parang siyang magic pill, okay? So, there. So, I hope you try it also. But, okay, do not just take this without your doctor's advice or without your doctor's guidance. It's still very important. Whatever medicine that you're taking, it's still very important that you ask your doctor about it, because all the medicines should be tailor-fit to you, okay? It's not a one size fits all, diba? So, lahat tayo, meron tayong mga precautionary things that we need to take note of. We have, when we prescribe medicines, we always take note of the history of the patient, the medical history, the family history, the social history, and the physical makeup of the patient, and the physical exam that actually we do. So again, all medicines are tailor-fit to you. I'm just talking about my personal experience. It worked for me, and you ask your doctor about it, and if your doctor is okay with it, why don't you go and try it, because it's very effective, it's very safe, and there. So this is just something that I wanted to share with you. Okay, so thank you very much. I hope you stay safe and keep practicing the safety protocols. Wear your mask, okay, properly. Cover your nose, cover your mouth, okay? And then, wear your face shield. Face shield is very important. And always make sure to use alcohol or wash your hands frequently if you can. And social distancing, please, okay? Social distancing. Okay, stay safe, everyone. God bless you. Bye-bye.